Hi everyone, it's Dr. Langford. I wanted to talk to you about something that's a really uncomfortable topic for a lot of people, and that's being overweight. Being overweight has a real impact on your general health, your bladder health, and your overall quality of life. I know this because I've been overweight as well, and I know what it is to feel uncomfortable just doing daily activities and not being confident that you're able to do some of the things you want to do because you're embarrassed about your weight or you are physically unable to do those things, period. So I think that it's important for us to talk about diet and how important it is to your overall health. Recently, I had a patient send me an email, and they're not even a patient of mine anymore, but they told me how we had gotten them about 70% better with their bladder issues. And then when they lost another 40 pounds, she actually ended up getting 90% of the way of where she wanted to be. So it's just a testimonial to the fact that bladder function is definitely affected by your weight. So what do you do about it? Well, first you have to face facts. If you're overweight, you need to realize that you are overweight and that there is a way out. You can do some things about it. So you don't even have to lose a ton of weight. You can lose 5-10 pounds at a time, and that really makes a big difference for your overall health. So there's a lot of things out there. There's fads where you do intermittent fasting, you do Atkins, all these different things. But the bottom line is a healthy calorie controlled diet is the main objective for what everybody should try to aim for weight loss. Weight Watchers is an excellent resource. I suggest that people go to Weight Watchers and consider using them as a guide for how to do things. If you don't want to use weight loss, I have on my website, which is bladderbodyconnection.com, I'm going to put up some dietary guidelines that I think are very useful. The three main things I think are super important is to know that calories do count. If you burn more calories than you are ingesting, you will be losing weight or maintaining weight. If you eat more calories than you're burning, which most of us do, you will either gain weight or you will continue to be overweight. So you have to count calories. My general guideline is if you're burning 2,400 calories a day, look at a Fitbit or a regular watch that has the Apple Watch that has the calorie counter on it. And if you're burning 2,400 calories a day, then eat 1,200 calories a day. That's a safe bet to lose a few pounds a week just with monitoring your calories. So the first thing to know, calories are important. The second thing to know is that it is important to eat a healthy diet. Your body needs certain nutrients. It functions better on certain foods than others. And for the bladder and bowel and really your general health, I recommend a more alkaline diet. What does that mean? An alkaline diet is really almost along the lines of a vegan diet. Now, everybody says vegan and they freak out and think it's such a hard thing to do. However, it's basically 80% vegetables, 20% other things that are higher in carbohydrates or sugar or animal products. So you just have to aim towards a very healthy diet. You want to have 80% vegetables in your diet versus 20% of the other things you enjoy. I don't believe in depriving yourself of everything. I think there's a place in life for everything, however, in moderation. So I hope these are some guides that are helpful to you. If you're interested in other ways of losing weight, we are also going to be offering some in-office semaglutide injections for people that are interested. These are what everybody's heard about, the Ozempic weight loss programs. And in many cases, some patients are just not able to reach their goals without a little bit of assistance with that. If you're interested in any of these options, please go to my website, bladderbodyconnection.com, or contact us at bladderbodyconnection@gmail.com. Thanks. Have a great day.